Eileen Davidson, the Educational Media Assistant with the International Foundation of Autoimmune and Autoinflammatory Arthritis. I'm going to discuss what I learned about mental health and rheumatology at the recent American College of Rheumatology conference held in Chicago last month. I went to three sessions that I will be discussing. First was the mental health innovative and scalable treatment approaches. Another one was recognizing grief and depression, why it matters in patients with rheumatic diseases. And finally, innovative support group models, leveraging technology to enhance patient engagement and quality of life. So it was a fantastic ACR this year, and I was really happy to see mental health talked about so much, especially in such powerful sessions. The first one I'm going to talk about was the recognizing grief and depression one, why it matters in patients with rheumatic diseases. Depression and anxiety are far more common among people living with autoimmune and autoinflammatory diseases than the general population, yet only about half adults and even fewer teens get the help that they need. Chronic inflammation, pain, fatigue, and the loss of independence all take toll on mood and coping abilities. One speaker, Dr. Courtney Wells, a researcher and patient living with juvenile arthritis, explained how grief, stress, and isolation often build up over time. Many patients mourn the loss of who they were before diagnosis, she said, recognizing that grief is a natural part of living with chronic illness and finding support for it can help prevent depression from taking hold. I find her really interesting and I really enjoy seeing her speak because she is somebody with lived experience, a researcher, and also a social worker. I've seen her talk a couple times. It was really just profoundly impactful to listen to her talk about how grief needs to be recognized and how it needs to be recognized throughout our journey living with AR arthritis because it builds up over time. It's not just one thing that happens and then we're going to have to get over that. It's a series of things, losing ability to work, mobility issues in joints, relationships, all things like that. It's something that really needs to be addressed in both our care and also us as patients. We need to address it. And then they had a physician assistant named Barbara Slusher, a certified lifestyle medicine practitioner. And she spoke about how food, movement, sleep, and stress management play powerful roles in emotional health. That was a very common theme that I saw across many of the different sessions that I attended was movement, diet, food, sleep, and stress management. So those are definitely some things to consider about how are you handling those in your care. So of course, nutrition, a plant-forward Mediterranean style food map helps reduce inflammation and may also boost mood. Regular exercise or physical activity is one of the most effective treatments for depression and anxiety, often as effective as medication for mild to moderate symptoms. Living with rheumatoid arthritis and also clinical depression, that one really stood out to me. It reminds me how important it is to also treat our mental health as we do our physical health. They're just equally as important. Sleep, quality rest helps reduce pain and inflammation while also improving emotional resilience. And then, of course, stress management. Nice to hear this one talked about a bit more. So, a lot of talk about mindfulness, social connection, and pacing strategies can all help lower anxiety. She also emphasized that sleep and movement are medicine and that even small, sustainable changes can make a big difference, especially over time. Then they had the third speaker, Dr. Hanna Zembruska. I hope I pronounced it correctly. She was a rheumatologist and psychiatrist. So she has two specialties and a really interesting perspective on how she can bring rheumatology and psychiatry together. And she spoke about how antidepressants, such as SSRIs or SNRIs, can actually help patients. So she talked about starting medications going slow and going low at first, and noting that it's really important for communication between rheumatologists, primary care doctors, and psychiatrists to work together. Now, not every rheumatologist prescribes psychiatric medication, but they can screen for depression and connect patients with the right specialists. If you are feeling like maybe depression is taking a hold of you, it's okay to bring that up to your rheumatologist, and they should be able to help refer you to a specialist. She also stressed the importance of monitoring side effects, drug interactions, and withdrawal symptoms, and then also validating how patients feel throughout our treatments. One of the moderators talked about breaking down stigma and misinformation. So there was a little bit of talk about like there's a lingering stigma around antidepressants, especially in diverse communities. Antidepressants are not addictive, and withdrawal symptoms are not sign of dependence. There needs to be more education and open conversation about how this can ease fear and mistrust for different medications, but also how they can help people who have rheumatic diseases and pain, because a lot of the SSRIs or SNRIs can actually help with how our brain processes pain. So that's why there was such a talk on that. Now it's going to be different for everyone, and it's best to talk to your physician about which one would be best for you. But it is something to definitely consider. It's not just for our mood, but also our physical symptoms. Now, they also talked about how patients and providers can then, of course, work together, asking about your mental health at each visit. Tell your physician, are you experiencing feelings of grief, heightened fatigue, or hopelessness? They should hopefully then use screening tools to identify depression and anxiety. And then there's a big call for collaboration between mental health professionals, occupational therapists, and support groups. And they're also encouraging self-care practices, of course. That was huge theme. Exercise, rest, connection with others, and then also to validate loss and frustration. These are valid parts of the patient journey, and it's nothing to do with personal weakness. One of the other sessions I attended with the mental health theme was mental health, innovative and scalable treatment approaches. So also going into what kind of works to help treat us in a holistic way, both mind and body. So, of course, living with a rheumatic disease means managing more than just physical symptoms, but recognizing and caring for mental health is an essential part of our treatment. And Dr. Wells put that emotions are not separate from our bodies. When we care for one, we care for both. Mental health session centered on straightforward but urgent reality. Many patients with rheumatological and musculoskeletal diseases are dealing with significant mental health challenges that often go unrecognized and untreated. And the people in the panel made it very clear that depression, anxiety, trauma histories, and chronic stress are not side issues. They directly shape pain and function, adherence, and long-term outcomes. And the problem isn't lack of awareness, it's actually a lack of resources and system capacity. And then, so these were international speakers from a different international interprofessional backgrounds. And so they highlighted things like emerging telehealth and remote strategies designed to close that gap, and how digital mental health tools, remote cognitive behavioral interventions, virtual pain coping programs, and ways to integrate psychological support into routine rheumatology care without overwhelming already strained clinics. Several examples focused on models that use brief structured interventions delivered by nurses, allied health professionals, or trained facilitators to extend reach beyond traditional mental health providers, and how this needs to be redesigned into clinical effort, and that screening tools actually need to be in our electronic health records. So yeah, overall the session underscored that if rheumatology wants to meaningfully address patient well-being, scalable mental health support must come from standard of care and not an option or add-on. So moving on to the third session that I saw that also had to do with mental health side and other ways than just going to therapy was innovative support group models leveraging technology to enhance patient engagement and quality of life. This was a fantastic session. It was with Giselle Morales, Alicia Patrick, and Cheryl Crow. And it was one of those conversations that reminds you why support groups matter so deeply for people living with chronic illness, like autoimmune and autoinflammatory arthritis. Giselle started off by sharing the evolution of the Charla program, a bilingual lupus support group that she's helped lead for more than a decade at the Hospital for Special Surgery in New York. She explained how Charla moved from in-person meetings to virtual during the pandemic and now into a hybrid model that has actually expanded their reach across the country and even internationally. So it's gone from just being at the Hospital for Special Surgery, but internationally. That's cool. It was interesting to hear the outcomes. 99% of participation satisfaction and over 90% reporting better coping. So beyond those numbers, she talked about how these groups give people a safe, judgmental free space to show up as they are, especially on days when they're really struggling. Then Aisha Patrick, who runs Sisters with Psoriasis and the Psoriasis Collective, communities built specifically for Black women and other women of color. She took the mic and really shared her deeply personal experience as a Black woman diagnosed with psoriasis in 2020. And she talked about being misdiagnosed, dismissed, and not seeing herself reflected in the standard support groups that were available to her. So that's why it really pushed her to create those support groups. And she made it clear that culturally competent support isn't just optional, it's essential. Representation, diverse leadership, and accessible options like virtual or phone-based groups all matter if we want support spaces where everyone feels safe and included. And then, of course, there was Cheryl Crow with her program, Room to Thrive, and how that has a support group added to it too. She also brought in her professional experience as an occupational therapist and her lived experience with inflammatory arthritis and as well as living with anxiety. She talked about how virtual support groups have opened doors for patients who can't travel or who need safer environments due to infection risk or just prefer for the time saving aspect of it as well. She was honest about the challenges, especially when there's misinformation and also the emotional burden on the facilitators. And she shared how she balances evidence-based information with storytelling and empathy, and how important it is for facilitators to take care of themselves so they continue caring for others. As somebody who used to run a support group, I do understand that it can be quite overwhelming at times when we are dealing with illness ourselves. So even though support groups have so many benefits, they also do have some, I wouldn't say disadvantages, but just barriers that make them really easy to facilitate. And so I just thought that was one way to really highlight that, yes, there is a lack of mental health support in rheumatology for us patients. However, support groups can be such an incredibly important thing for us when we do need people to talk to, especially people who understand what we're going through and how that can actually really help us with the social connection, which you remember hearing was talked about a lot earlier in some of the sessions, as well as just our mental health support. And then you can also learn from other patients as well. So learning exercise routines or tips from other patients, favorite recipes, or even just ways to explain talking about our conditions is another reason why support groups are so beneficial to people living with autoimmune and autoinflammatory diseases. That was the mental health theme that I saw being spoken about at the American College of Rheumatology conference in Chicago last month. It wasn't a ton of focus on just medication. It was more holistic and ways how rheumatologists can screen for grief, depression, loneliness, anxiety, and then help us get the support that we need. And that it could be from organizations with support groups or clinicians that they could refer you to, medications they might be able to prescribe you to, or even support groups connected to different organizations or individuals like Cheryl Crow. So I hope you found a few golden nuggets in this little debrief today. Thank you.